Cancer cells are metabolically hungry. They rewire nutrient pathways to support uncontrolled proliferation, including dramatically increasing NAD, turnover to fuel glycolysis, DNA repair, and survival pathways. This dependence on NAD makes NAD metabolism an attractive target for cancer therapy, either to starve tumor cells of NAD or to exploit weaknesses in their redox and DNA repair needs. While much of the buzz has centered on NAD, consuming enzymes like PARPs, e.g., with PRP inhibitors or salvage pathway blockade, e.g., NEMPT inhibitors like FK866, niacin's simpler, price-handler pathway entry point offers unique therapeutic possibilities that remain largely unexplored. Cancer cells often rely heavily on the NEMPT-dependent salvage pathway, NEM, NMN, NAD, to maintain their NAD supply. This is because NEMPT is upregulated in many tumors, making it a metabolic bottleneck. Inhibiting NEMPT with drugs like FK866 can deplete NAD rapidly in cancer cells, selectively inducing energetic crisis and apoptosis, while sparing normal cells with more flexible NAD synthesis routes. However, this approach can cause toxicity in healthy tissues that also depend on salvage NAD production, and resistance mechanisms can emerge. This is where niacin could play a fascinating dual role. Because niacin enters NAD biosynthesis via NAPRT and the price-handler pathway, it bypasses NEMPT entirely. In cancers with intact or upregulated NAPRT, niacin supplementation could potentially rescue NAD depletion from NAMPT inhibitors, protecting healthy tissues or even tumors themselves. Conversely, in tumors lacking NAPRT expression, which many do due to epigenetic silencing of NAPRT1, niacin cannot be converted to NAD in the cancer cells, leaving them vulnerable to NAD, targeting therapies while healthy tissues with active NAPRT remain protected. This creates a therapeutic window where niacin could serve as a tumor-selective NAD rescue agent. Indeed, recent preclinical studies have explored combining NEMPT inhibitors with niacin in models of NAPRT-negative tumors. Niacin co-treatment reduces toxicity to normal tissues without rescuing NAD in cancer cells, enhancing the therapeutic index of NEMPT blockade. This approach could make NAD depletion strategies safer and more selective, a critical advance given the systemic toxicity that has limited clinical success of NEMPT inhibitors so far. Moreover, niacin's distinct NAD synthesis pathway may also modulate the tumor microenvironment's immune landscape. By activating GPR109A on immune cells, niacin can promote anti-inflammatory or tolerogenic responses, which could be harnessed to alter immune infiltration in the tumor stroma, potentially limiting inflammation-driven tumor progression or supporting certain immunotherapies. Another provocative, though speculative, angle involves niacin's ability to induce niacin flush through prostaglandin D2/E2 release, which has been linked to increased tumor perfusion. While this might seem undesirable if it boosts nutrient delivery to tumors, it could also be exploited to enhance drug delivery by temporarily improving microvascular flow in poorly vascularized tumors, a classic double-edged sword requiring careful study. On the flip side, some fear that any NAD boosting strategy might support tumor survival since NAD fuels glycolysis and DNA repair, both hijacked in cancer. Yet real-world data do not show increased cancer incidence in populations treated with high-dose niacin for cardiovascular disease, suggesting that moderate or context-specific NAD restoration does not necessarily promote tumorigenesis. And since niacin's NAD production depends on NAPRT status, tumors lacking this enzyme cannot effectively exploit niacin even if they crave NAD. Altogether, these dynamics suggest niacin's price-handler pathway represents a precision opportunity in oncology. Assessing tumor NAPRT expression could stratify patients who might benefit from niacin as a protective agent during NAD depleting chemotherapy, or identify cancers vulnerable to NAD starvation because they cannot use niacin at all. This approach, matching niacin therapy to tumor NAD metabolism, could open an underappreciated avenue for safer, more selective cancer treatments.